after the patient enters the room, I'll make sure I stage the environment correctly by placing a sheet on the table and having 2 towels available and an additional sheet for the draping that I'll need to do. I will also bring with me 2 pillows with pillowcases, one for her neck and one for her behind her knees. And this will just be for short-term positioning because she will leave after this treatment is done. And I will also make sure to place a bed alarm at the table and let her know about it just in case she needs any help if I leave the room. All right, before entering the room, I'm going to wash my hands using proper hand hygiene. So I'm gonna make sure the water is warm, not hot. Dampen my hands beforehand, get a full pump of soap. Wash all lasts for 20 seconds. I'll wash my hands off. Grab my paper towel and shut the water off with my paper towel. And I'd also use this paper towel to open the door as I'm leaving and then properly dispose of it just in the safe waste. And now I'm going to put my PPE on. So my patient has hepatitis C, which only requires standard precautions, which is washing your hands and gloves. But she also did mention that she has a leaky dialysis port, so I'm going to don a gown as well so I don't get any of the blood. Hello, Jolene. I am Heidi. I'll be your student physical therapist today. How are you?
I'm fine.
Good. So today we're going to be treating your left iliopsoas, which is connected basically from your spine, kind of in this abdominal area, all the way down to your upper thigh. Does that make sense, kind of that area?
Yeah.
Yeah, so to work on that, I'm going to want that skin-on-skin contact. If that's okay with you, I'll give you a gown to take off your pants and your underwear so we can really work on that area, but I'll definitely make sure to drape you properly to maintain your modesty, make sure you're warm and comfortable. Does that make sense?
Yes.
Are you comfortable getting into a gown?
No worries.
Awesome. So I'm just going to leave the room and let you change, and I'll be back in a few minutes.
Okay.
All right.
Come in.
Hello again. Oh, come here, Piper. Sorry, there's just dogs walking around here.
Therapy dog.
Perfect. So now you're going to change into your gown. I'm going to have you actually lay on your back for the treatment.
Okay.
And we'll have that pillow under your head. Make sure your neck isn't too flexed. Is that comfortable for your neck?
Yeah.
Perfect. And then we have you lift your knees up. Wonderful. And that is to make sure you have a neutral spine for your lower back. All right. After positioning the patient with the pillow behind her neck and her knees, I will also ensure that the patient feels safe and is safe, as well as comfortable. I also would have had the patient in the center of the bed, but this bed is a little big, so I wanted to be able to access my patient. But if I were on a typical treatment table, I would make sure that the patient is in the center of the bed. So now I'm going to drape you to make sure that we're only exposing that abdominal area and your upper thigh. If at any point you feel uncomfortable, please let me know and I'll make the proper adjustments. Now what I'm going to do is shimmy the sheet up underneath the towel and just make sure I have minimal skin exposure as possible.
All right.
Here is the iliopsoas. Now that the patient is gone, I'm going to properly dispose of all the linens in the biohazard bin because there is the potential for there to be blood on them. So I'm going to take these, put them in the biohazard bin, take this bottom sheet, put it in the biohazard bin, both pillowcases in the biohazard bin, and then I will start to properly doff. Sure that I take it off inside out. So the outward part is all within, not to spread any more of the infection. And I'll throw that in the biohazard bin in that patient's room as well. And then I'll wipe down the treatment table, maybe with another pair of gloves, and make sure once I exit the room I properly wash my hands for 20 seconds again with warm water.